Welcome to Clinical Capsules, your go-to podcast and trusted source for quick, evidence-based insights from TRC Healthcare. For 4 decades, we've been keeping healthcare professionals at the forefront of drug information and medical knowledge. And now we're bringing these vital clinical updates right to your ears every second and fourth Tuesday, delivering practical, actionable takeaways in bite-sized episodes. Today, Associate Editor and Clinical Pharmacist Dr. Vickie Danaher discusses the treatment of conjunctivitis in an excerpt from our popular Pharmacy Essential Updates webinar series. Let's get started.
So let's jump right into our topic about treating conjunctivitis or pink eye. And our article says you'll get questions about managing pink eye since patients often visit pharmacies first for help. So, as we increasingly become the first point of contact for many patients, we'll want to make sure to have a basic knowledge of common eye disorders, including pink eye. So, let's start by reviewing conjunctivitis, which we know is an inflammation of the conjunctiva of the eye. The conjunctiva is the thin, clear membrane that covers the inside of the eyelids, as well as the sclera, or the white part of the eyeball. Conjunctivitis causes redness and eyelid swelling, and it's most often caused by an infection, although there are non-infectious causes of conjunctivitis as well. And one common myth is that only children get pink eye, but it's not just a kid's condition. Pink eye can affect people of all ages at any time. However, kids do get pink eye more frequently than adults since they're more likely to rub their eyes or not wash their hands properly, and they're often in environments where pink eye spreads more easily, such as school or daycare. So, what is our role when patients present to the pharmacy with pink eye? As pharmacists and technicians, we know we're not experts at diagnosing or treating eye conditions, but we're still in a key position to discuss or assess the patient's symptoms and recommend treatment or refer patients for further evaluation based on the symptoms that they present with. And then if patients need a medication to treat pink eye, we definitely are the experts at ensuring they get the right product and educating them on proper use. So let's work through a patient case together to apply this to practice. And here we have Liam, which is a 2-year-old patient, along with his mom, who are regulars at our pharmacy. Liam's mom tells you that he was sent home from daycare today due to pink eye, and she wants to know what she should do, since she can't get Liam into the prescriber for a day or two. So what would you do here? And what questions would you want to ask about Liam to help determine next steps? So, in thinking about this case, I know a lot of questions are popping up in my mind, and most of these questions are things that we can ask any patient with eye symptoms to help assess the problem. So, we can ask things like what kind of eye symptoms are present? When did those symptoms start? Did the symptoms affect just one eye or both eyes? What makes the symptoms better or worse? And whether the patient has any other body symptoms, such as a cough or ear infection. And it's important to find out the answers to questions like these when patients have pink eye, since they can help us determine the cause of the problem and guide appropriate treatment. So, to give a high level overview, there are many different types of conjunctivitis, but the 3 main ones that we see are either viral, bacterial, or allergic in nature. So, viruses are the most common cause of conjunctivitis overall and in adults, with the majority of cases due to adenovirus. Bacterial conjunctivitis is the most common cause in kids, with culprits often being Haemophilus influenzae, Staph aureus, or Strep pneumoniae. And then allergic conjunctivitis is due to allergens or irritants, so things like pollen, animal dander, dirt, or air pollution. And symptoms usually occur more often in the spring and summer, similar to seasonal allergies. Let's now go through each of these types of conjunctivitis separately to see what symptoms patients may present with and what we should recommend for treatment. So, starting with viral conjunctivitis, again, this is one of the most common types of pink eye, and it's highly contagious. These patients typically present with eye irritation or a burny or gritty feeling, along with eye discharge that's thin, clear, and watery. The symptoms begin in one eye, but quickly spreads to the other eye. And given the viral cause, patients often present with upper respiratory infection symptoms at the same time. So things like a runny nose, cough, or sore throat. And this can help assist with differentiating between other causes of conjunctivitis. And oftentimes patients or parents will ask about a antibiotic eye drop for viral conjunctivitis. But we want to tell them that antibiotics are not indicated for viral conjunctivitis. The use of antibiotic eye products has been shown to be ineffective for pink eye due to viral causes, and it may lead to adverse effects such as allergy, toxicity, a higher risk of infecting the other eye, and it can also increase antibiotic resistance, and it may even delay diagnosis of other possible conditions. Plus, most cases of viral conjunctivitis resolve on their own within 1 to 2 weeks without antibiotic treatment. So instead, we should focus on managing symptoms and recommend measures to keep patients comfortable and reduce irritation. So, for example, we can recommend using cool compresses for eye swelling or itchiness, or warm compresses to soften eye crust or matting. We can also suggest a lubricating eye drop or artificial tears to help reduce irritation. And all these are measures that can be useful for viral conjunctivitis, as well as the other types of conjunctivitis that we'll talk about today. So, moving on to bacterial conjunctivitis, these patients also usually have a burning feeling in the eye, but their eyes have thick discharge that is often white, yellow, or green with pus. And this causes the eyelids to be crusty or sticky, especially in the morning. So, patients may wake up with the eyelids stuck shut because of that residue. Bacterial conjunctivitis generally starts in one eye, and it can spread to the other eye. Sometimes the bacteria that cause pink eye can also cause an ear infection, and this tends to be most common in young children. So you may see patients with both of those infections. But as far as treatment for bacterial conjunctivitis, again, most patients with uncomplicated cases will get better on their own, and most cases will resolve within a week without antibiotics. While antibiotics may lead to a little bit quicker recovery time and may help reduce transmission, again, antibiotic overuse can lead to more costs, more side effects, and more antibiotic resistance, as I mentioned earlier. So, no treatment or a wait and see policy are often reasonable approaches for uncomplicated cases of pink eye from bacterial causes. And in the meantime, we can recommend measures to relieve symptoms, again, such as cool or warm compresses or artificial tears as needed. So we'll generally want to save antibiotics for bacterial conjunctivitis if patients don't start getting better within about 5 days or so, if they have more severe symptoms such as copious or tons of discharge, or if treatment is required for patients to return to school or daycare or work. Many of these places do have policies on this, and that is another thing that needs to be taken into consideration. If an ophthalmic antibiotic is needed for bacterial conjunctivitis, we'll want to be familiar with some of the common options. So patients may get meds such as ciprofloxacin or ofloxacin ophthalmic solution, erythromycin ophthalmic ointment, or trimethoprim polymyxin B ophthalmic solution. Be aware that no evidence exists demonstrating that one option is better than another, so the choice is usually based on patient or prescriber preference, such as a med that is more convenient or less expensive for the patient. And patients will usually be advised to treat for 5 to 7 days. Let's look at allergic conjunctivitis next. Typical symptoms here include red, itchy eyes, with both eyes affected, along with thin, clear, watery discharge. But unlike viral or bacterial conjunctivitis, allergic conjunctivitis is not contagious, so it can't be transferred from one person to another. If patients have allergic conjunctivitis, the first step is to remove or limit exposure to the irritant if possible. So, trying to avoid common triggers like dust, pollen, mold. For example, someone with an allergy to house dust mites may find that removing carpet, using dust mite covers for pillows and mattresses, and washing bedding in hot water are enough to reduce symptoms. Or a patient with an allergy to animal dander may decide that they need to remove the animal from the house altogether, particularly if their symptoms are severe. We can go ahead and suggest simple home measures again to relieve symptoms, like the cool compresses to reduce discomfort, lubricating eye drops to help flush allergens from the surface, and washing hands frequently to remove any allergens. But in more severe cases, patients may need prescription or OTC eye drops that contain an antihistamine, such as olopatadine, or a mast cell stabilizer, such as ketotifen. Now, a lot of times questions come up about whether steroid eye drops should be used for allergic, bacterial, or viral conjunctivitis. But in most cases, corticosteroids aren't needed and should be avoided. That's because corticosteroids can potentially prolong or worsen some types of eye infections. And steroid eye drops are also associated with cataract formation, glaucoma, and other risks. So they're usually saved for the worst cases of conjunctivitis, and even then used with caution. So overall, most of the time, patients can treat pink eye at home until it goes away on its own, regardless if conjunctivitis is due to viral, bacterial, or allergic causes. But there may be other times when there's something more serious behind the patient's symptoms. We'll want to refer them for further evaluation. So, for example, listen for patients reporting vision changes, light sensitivity, or eye pain. Also, refer those with a rash or vesicles around the eye or the eyelid, as this may indicate a herpes or shingles infection. Advise patients wearing contact lenses to remove them immediately, and to contact their primary provider to rule out other problems, such as a corneal ulcer related to contact lens use. And again, most cases of infectious conjunctivitis will not need antibiotics. But we still need to be prepared for how to handle these prescriptions and educate patients if treatment is indicated. So, going back to our patient Liam, let's say that after a couple days, his symptoms aren't improving. He gets in to see his pediatrician, and the pediatrician diagnoses Liam with bacterial conjunctivitis and sends over the following e prescription. The prescription is for tobramycin, 0.3% ophthalmic solution. Instill 1 to 2 drops into both eyes every 4 hours for 5 days. Quantity 1 5 ml bottle with no refills. When Liam's mom comes to pick up this prescription, what are some things that you'd want to talk with her about? For example, do you have any tips on how she should administer these eye drops to Liam? So, one big thing that we'll want to educate patients or caregivers on is how to prevent the spread of viral or bacterial conjunctivitis, again, since it's highly contagious. So, advise frequent hand washing, tell people to avoid touching their eyes, and remind them not to share bedding, towels, or other personal items. We'll also want to advise throwing out any recently used eye makeup or contact lens cases to reduce the chance of reinfection. And then, if patients get an eye medication, we want to be ready to provide tips for appropriate administration. For example, we can tell patients to wash their hands, tilt their head back, and make a pocket with their lower eyelid. And they can do this by pulling the eyelid down and away from the eye with the index finger, or by pinching it with a thumb and index finger. Advise looking up before instilling the dropper ointment. And then, after the dropper ointment is in the eye, patients should release the lower lid and close their eyes gently for at least a minute or two to let the medicine evenly cover the eye. If people have trouble using this method, or if parents are giving drops to kids, there's another option that may be easier. For example, the patient can have the child lie down and close their eyes. They can then place a drop in the inner corner of the closed eyelid, and then have the child open the eye slowly to allow the drop to roll in. And then with either technique, we want to educate that if more than one drop is needed per dose, to wait at least 5 minutes before putting another drop in the same eye. Remind patients or caregivers not to touch the dropper or tip of the tube against the eye to prevent reinfection or injury, and to wash their hands after administration as well. If patients need multiple eye meds for conjunctivitis at the same time, so they're using an antibiotic and artificial tears, for example, we want to recommend instilling solutions first, then suspensions or gel forming drops, and then ointments. And this can help ensure adequate absorption of each product. Tell patients not to wear their contact lenses when infected, and also suggest following any guidelines from school, work, or sports on staying home while contagious. Point out that bacterial infections are contagious until antibiotics have been used for 24 to 48 hours, and viral infections are likely contagious until the eye clears. When dispensing eye meds for pink eye, it's also important to stay alert for errors and other dispensing issues. We know that eye drop prescriptions are often targets of insurance audits, so this is a good reminder to check payer policies on the number of drops per ml to use to calculate day supply. And if we get a quantity or day supply reject, we want to call the payer for clarification and not automatically override those rejects. We'll also want to keep an eye out for dosage form mix-ups, since many meds come as both ophthalmic solutions and as otic solutions in the same or similar looking strengths, like ciprofloxacin and ofloxacin, for example. And if we dispense the wrong dosage form, it could lead to patient harm. For instance, using ciprofloxacin otic solution in the eyes instead of ophthalmic solution in the eyes can lead to severe burning and eye pain. Now, a lot of times there's confusion about this because certain meds can be used via alternate routes. So we want to remind prescribers or patients that eye drops can generally be used in the ears for an ear infection, such as if an eardrop isn't available or it costs too much. But on the other hand, eardrops should never be used in the eyes. So eardrops are usually acidic and they aren't buffered for the eyes. They have preservatives that may harm the eye, and they aren't always sterile. So this is a good reason to watch for lookalike products when stocking and double checking the full product name, including dosage form, when dispensing these prescriptions, and getting clarification for any unclear prescriptions. And for more ways to help patients use over-the-counter or prescription eye or ear meds safely, you can see our resource called The Ins and Outs of Eye and Ear Meds. This resource is specifically designed for our pharmacy technicians, but it has some great pearls about drug interactions, day supply, and storage that are good reminders for everybody in the pharmacy.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. And if you're a student, good news. Students can access a free version of Pharmacist Letter. We've linked to that directly in the show notes as well. Check it out. Find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Clinical Capsules.